from Atkinson Physiotherapy. In the next exercise, in association with trying to target the running community, or for anybody else in that matter who are doing some impact related activity. So what we see a lot in physiotherapy clinic is sometimes overuse, injuries associated with the lower limb and the calf area. In particular, we see a lot of injuries that are associated with the tibialis posterior muscle, which is a muscle that is deep into the calf near the shin area, and it winds around the inside of the foot towards your arch area. So some people blame it a lot on being flat-footed. You can appear to be flat-footed and never get that problem, so that's normally not associated. What's more important is sometimes it's an overuse, maybe starting off running too quickly too soon, or a sudden change in intensity, or your distances or your terrain of what you're doing, and sometimes people starting to notice it around the inside of the ankle or the arch area, maybe into the calf area on that inside as well. So we do see it a bit from a biomechanical aspect. So when I do gait analysis with people or running analysis, we'll often maybe see people who do over-pronate and maybe predominantly loading the foot and ankle too much through that side to get that as a muscle tendon related problem. So this is a very simple exercise that you can maybe do to target that area into a strength and conditioning program. So again, working those principles, if you can, is if it is really painful, best to get checked out from someone like me or a physio first, because you want to make sure that the irritability of your injury and associated with the tibialis posterior muscle is not being overstimulated with this exercise. So normally I would assess somebody in clinic before prescribing it, but if you're generally pain-free and you want to add in some other conditioning exercises, then this can be great for that. So all I'm using in this instance, again, I'm using the wall for a little bit of hand touch stability. I'm using a step. So the step can be used in association with you doing a calf raise, but I'm going to be using a tennis ball, and I'll show you what that's for. Because we know that the tibialis posterior muscle comes down the inside of the calf and around the inside of the foot and ankle, it helps to drop the foot forward, but it helps to control that movement inwards, so we call that inversion. So we're going to use the ball between our ankles, and when we squeeze in against the ball to do a calf raise, we're going to be working a portion of that muscle isometrically, meaning it's working without movement. And then as we raise, we will also be incorporating as well some of that muscle activity as we raise through a calf raise. So put a ball, and I'll show you now, you're going to be between your ankles, and then you're going to be going into a calf raise and lowering down slowly. So I'll give you a demo. Just roughly where the arch area is of your feet. Give it a squeeze in if you can. If it wants to move around, move it a little bit further up so you can wedge it. Use hands for stability and try and keep your feet together. Squeeze the ball between your arches and then raise into a calf. Lift, straight knees and lower down slowly. So you should feel that working through as well through the calf area, but also through the inside of the foot. Try to target through the big toe, through the middle part of your feet, and then lower down slowly. You can also use, if you've got Pilates balls, so you don't have to use tennis ball. That's quite rigid, so it's quite useful to squeeze in. These tend to be a little bit softer, okay, so you have to squeeze in between your arch, hold that position as you go through a calf raise. I'll show you again. So between the feet and ankles, feet point straight ahead, finger touch on the wall, push the ball between the arches, keep it wedged there, raise up onto the tiptoes and slowly down. So the foot's just halfway off the step. And see if you can go up normal speed and lower down over 5 seconds. And that's the next of my exercises, which is targeting the tibialis posterior, the arch area of your foot and ankle. Okay, tune in for the next one, which will be looking at a bit more activity around the quad area and the glute combined. Okay, thank you.